Good morning, everyone. So today we have our special guest, Dr. Bharati Nikhare, who's our student, not a recent graduate. She's an old graduate, and she took a pre-match in family medicine. So we want to understand her challenges, her journey, and how she overcame some of those issues to have a successful match this year. So Bharati, welcome, and glad to have you here.
Thank you so much, Pawan. Really appreciate that.
Thank you. So let's start off with your year of graduation and some background about yourself,
Sure,
where you come from.
sure. So I'm an international medical graduate. I came from India. My year of graduation is 2007.
Ah,
So since seven, I did one post graduation that is in preclinical subject. That's anatomy. So 2009 to 2012 was my year of the total year of my post graduation. So after that, I finished DNB, which, as you know, benefit if you give just an exam, you don't need to do the rotations and everything. So I finished DNB anatomy in 2014,
ah,
and then I came here. So it's like year of graduation is actually seven, and nothing since then. The clinical thing since then.
nothing clean.
But yeah, so I came in here in 2014. It took me a while actually to decide to USMLE startup. So I was not ready because I was teaching there as anatomy, so anatomy teacher. So I was not willing to initially. But when I saw how, how I got connected with my family physician and overall the practice, what I loved about like doing working for women's health, working from children. So I overall like family medicine a lot. So seeing how it goes here, and we have a choice to do a residency in there. So I thought that, okay, let's start up with something. And I decided to do step one. And by the time I was working as a lecturer here in Penn State University, so I taught human biology here too. So
Mhm.
but teaching is it's good in between, but physician is what we have always wanted to be. So I thought that let's give it a try. To take actually step one took me 2 years, having a small child and getting mindset prepared. I had some personal issues too, but I overcame all of them and then did my step one in 2018. And
And
then, yeah, applied for 19, thinking that, oh my God, I'm all ready, but couldn't do in 2019 because I couldn't finish my step to CK. 2020 is the first match I applied with complete application. Couldn't match, had only one interview, but then 2021 is the one for me. And thank you very much for
yeah,
Pawan and Sarthi team. They helped me a lot. I cannot thank you enough,
okay.
really.
Thank you. So now let's dig a bit deeper into your challenges. So 2014 through, about 2021, 7 years. So obviously starting a family, relocating here, having a child. So these were some of the challenges. What were the other challenges in terms of probably getting clinical experience, probably preparing for the exams? What were those challenges?
So, as I started preparing as such in 2016, and to improve my, accent, to improve my communication skills, I had to join something or do something. That's the reason I started actually the lectureship.
Ah,
So that helped me a lot, because I was teaching non-medical students,
hmm,
and that helped me breaking down whatever medical languages which is in complex. It's easier to teach medical students because we learn in medical way, right?
yes.
But making it simple is what it was difficult. So starting from the layers of skin, it was really difficult. But then first year was difficult, but the next 2 years I learned to break down, and that really helped me actually in communication with the patients and the relatives. So when I'm telling them something, educating them something, that helped me to break down into simple things. So that was the biggest challenge, the communication skills. It initially I was not knowing a lot, but now I am much better.
Hmm,
And it's off the track though, but I did watch a lot of shows, TV shows,
okay.
especially the Bones and those medical shows. That helped me to understand the small little conversational things. We don't pay attention as an IMG. It is difficult to get all grasp all the communication things,
Right.
but that helped me.
Mm-hmm.
Yes. And because I'm in Pennsylvania usually don't give hands-on for IMG.
Right.
They are like, you only observe, you don't touch any patient, you don't get anything to do. So when I started with, observerships first. So I did ask my family physician. It's always a question where who to ask, who to ask for observerships. So I just went to my family physician, requested him that I am so and so, I want to just observe you. So then I started observing him. I asked my daughter's pediatrician too, and he let me too. One of Because I was working as a lecturer, there was a nursing school. So
Mhm.
nursing school head had her husband as a doctor, and that's how somehow I got connected. So I got 3 letters first time. So that's how I entered into the system, to know first to observe, and then I went to one organization. They helped me, align my rotations, and I did that one in the next year, like, because I got kicked out of the NRMP for 2019, and I thought that I need to get more clinical hands-on experience while doing
Mhm.
CK. So I finished my CFMD certification, and I got my rotations done. And those I mainly did in family. All of them were in family medicine.
Okay.
One of them was outpatient. Rest all were inpatient. So I did with program, the residency programs itself. So that helped me actually to know how the programs are working, how residents are working. I got a closer look at them, and also doing it at different places helped. So if
Right.
because I was in Pennsylvania and doing only in Pennsylvania makes other people see that she's not ready to move out. That's the reason I did at different places. One was Chicago, some of them were Florida. So I kept on moving around. That was really difficult, having a small child and going around the country. Yes, but we all overcame actually, including my daughter. She also understood it very well, that okay, mommy needs to go out. So yeah, so that was a time. But only one interview last season was really, challenging. I tried to, make connect with the program director, couldn't do well. So that went into not matching. But thanks to you, Pawan, you gave me straight head. Okay, this is how it's gonna be.
So, before we jump into this season, let me kind of summarize to make sure we got it right. The major issues that you overcame and that you found useful in the end, one is improving your communication skills. The
Right.
other is reaching out, probably networking as much as you could.
True.
And the third is, hands-on experiences or rotation.
Right.
So these were the main issues you faced and you overcame as an older IMG, right?
Right. Right.
Okay.
Correct.
Now let's move to this current season. So what changed in this season? I know you joined us and all, but in your own words, what changed in this season that you could perform so well? So what additional things happened?
Definitely. Best thing happened is you, Pavan, Sarthi. You guys really helped me. Small, small things, starting from personal statement. We have gone through so many cycles or so many, corrections. I changed my first personal statement to completely different personal statement once I get the review. So only one line I kept from my first personal statement. So that was a major change. The small, small things like personal statement, curriculum vitae, CV. Last year I didn't pay attention to how I'm wording it, what is needed. I was just writing, oh, I did this, I did that thing. But this year, I got correct way of what I should write in first line, what
Okay.
is the second 2, 3 lines important, and what is the last line important. That made my CV change from scrap or nothing to very good CV. So that helped me a lot, and we do a lot of revisions for sure. For as an IMG and as an old grad, I would say step 3 is the one which really helped me.
Okay.
So I was not having my step 3 last year. I did it intentionally before application. So my results were out before application. Doesn't matter what is the score. What is important is you have passed it. And they're sure that, okay, you don't need to worry about step 3 in the first year.
Okay. Then let's also talk about your work experience and how it translated into your interviews, because interview is all about what you bring to the table, what your experience is. So talk to us about what your interview experiences were. How did you prepare? How did you find those interview interaction, and how did you use your work experience to portray that you're ready, even if there is a gap of 13 years, you're now ready to start?
Sure, sure. So, as I told you that I was not clinically active before, like before I think 2018 was actually I started up again doing observership. Before that, there was no clinical experience from 2007. So before that, like 16, I started my lecturership. So that lecturership helped me a lot to make the program directors and the other interviewers recognize that I have the communication skills.
Mm-hmm.
I have the skills to break down the complex things which we need first thing in family medicine.
Right.
We need a doctor who would talk with the patient, educate the patient, and will make the patient recognize the need for taking care of themselves and how to follow the milestones. So that really helped me. So I had so many experiences from my current jobs. Like I was working as medical assistant at a refugee center. It's like a federally qualified healthcare center.
Mm-hmm.
I worked as a medical assistant. Not a big deal. People say that, oh, you are working just as a medical assistant, but that gave me a lot of experiences.
Exactly.
When I got that one, I called you, Pavan, that should I take it? And you said, just take it.
Yes.
But that really helped me.
Yeah.
So I had like a bunch of experiences ready. I had all experiences like from conflict, how I educate the patient, how what happens if the patient gets angry, how you handle it. So those all the questions which we are expecting in interview, I had all experiences ready because of my this experience.
Yes. Yes. Yes.
So that helped a lot.
Okay.
Working in family medicine residency along with them as a sabai, which I did last year, that also helped me actually knowing how how the flow goes, what happens when patient comes in, what does family medicine resident do, and how it happens later to the discharge. So
Mhm.
that helped me overall to get an idea, and then they could see that yes, she already knows this and she was ready to do it. So that also helped me a lot.
So, before we move on to your advice to the next generation or people who will apply next year, talk to us how you overall thought of our Telegram group, or, the interview preparation classes, because you attended many classes. What was your feedback? How did you find those useful?
Right. So the Telegram group, first thing, that is a group where all the mentors are available for you. So you have all the physicians, which are actively physicians, residents, fellows, they are there. So whatever question you have, they don't judge you at all. They would just tell you straight away, this is the correct answer. If you have any question, they will tell you the reality. That is what I loved most. Sometimes you feel like, oh, they are very straightforward, it hurts my feelings. Oh, they are very, I felt like, oh my God, I shouldn't have heard that, but that's the reality. You have to face it. If you don't face it, you won't go any further.
Mhm.
So that's what I took it positively. Every time, whenever any negative feedback came to me, I took it as, not personal, but it's for my personal improvement. Like talking in between, if some doctor is talking and you are saying, hello, how are you? No, don't say that. Listen to the doctor first and then talk, because that's rude. And that is American culture. You have to follow it. So that's what that is the smallest thing I learned, but that telephonic or telegram group helped me a lot in knowing small little answers for all my questions. And it's better to go back and listen and see what they have answered before asking a question, because you already get the answer. You don't need to even ask any question. So I did it a lot. So I went like 3,000 messages above to read all the
Yeah.
messages from the mentors. So that helped me.
What about
And
the interviews,
the
the interview
hmm,
preparation classes? How
preparation.
did you find those?
Yes, this year, last year, I joined you as an interview preparation person for interview preparation. But that you had given me everything in like these are the questions how to answer. But that was just listening is different than actually doing it. So
Correct.
I had the questions, I had what the answers were, but my answers were not ready. So I was not prepared last year. But this year, it started like very early. You get just four questions at a time, do that question, think about that. That is really really important. So
Yes.
having that four questions for a month or whatever for 2 weeks, you think only about those questions, you gather all your experiences, and then you word it properly, knowing that 90 minutes elevator pitch and everything, that's really really important. It is, you have to make what you need to talk in that small time and make an impression. You cannot just keep on talking and then it's going to waste your time, interviewer's time, that way. So that really helped me. Also, because we are having the group of 7 8 people, we listen to their experiences too, we listen to what they are doing too. So that also helped me to change my answer here and there a little bit. Oh, this way of saying is different than this way of saying, so change this part there. So that small things, but that when you do like 10 different interview preparation classes, at the end you are prepared, like, oh my god, I have all answers ready, I don't need to worry about it. So that's what happened. I had all my answers ready. I had this cards ready for myself. And one time came, the first two interviews, I actually prepared again, like saying that. Third, oh, I know it. I know it already. I know how to say it. So yeah, my husband was like, "You are need to. Do you want to see it?" No, I know it already. It's fine. And I
Right.
did same how I prepared. Well, how I prepared for the first, same I had for the last. So it's not like it's changed, but yes, definitely interview classes have helped me a lot. Major change from last time.
So now let's move to, students who may be in similar situation, older YOG, little experience, all those issues. What are your advice to them, 6 7 months out for the next match? How should they start, or what all should they be doing?
Okay, so first you need to decide what is your choice of specialty. You cannot put shoes to different boats. You have to decide what you want. Family medicine, internal medicine, pediatrics, what is your choice? And then follow that specialty. What family medicine, as a family medicine person, I would say that program leaders are looking for how much dedication you have for that particular specialty. They won't just take you because you have done three rotations observership somewhere and you got 3 letters from them. No, they don't take you. They would see how much you are really interested, how much dedication you have. Are you
Mhm.
following through that? Do you have volunteering on that phase? Like I had volunteering somewhere where I was working as for my kids daycare, and there I was working to take care of, to give some food and culturally change, cultural exchange. That is also a part of, they see as a family medicine doctor, they see that, are you, even though you are from some other culture, do you take the same culture well, the culture here well? So how would you communicate? Ultimately it comes to communication. So that's what I'm saying. If there is any old grad like me wants to pursue family medicine, I would say you need to show your dedication for that specialty. Keep doing rotations, don't stop. Does not matter if you're doing only observership, does not matter if you're doing medical assistant job, does not matter if you're doing scribe. Keep doing, it's going to help you ultimately, and you're going to have a lot of experiences which you could talk and convince them that you're the best person to go ahead.
So don't stop, keep doing something, network, and you'll get it. Okay,
Yes,
very good.
networking is a very important, that's for sure.
Well, thank you very much, Bharti. This was very, very informative, and I hope motivating to other IMGs who may
Sure.
be in similar situation and they may have lost all hopes. But listening to you, I hope it inspires a lot of people.
Definitely, definitely. Thank you so much.
Thank you. Thank you.